cysts do not need to be operated on. Breast cysts cannot be biopsied. If you are stage 4, then obviously your chances of cure are rather poor.
So when do they need to go for a second opinion?
Okay.
Do everybody need a second or a third opinion?
That is a very, very difficult question to answer.
Okay, we have a very special guest today, Dr. Ang Peng Tiam, who is my doctor, one of the leading oncologists in Asia. Dr. Ang, a lot of my patients, they come home, they see their ultrasound result and it has breast cysts, kidney cysts, ovarian cysts. So can you talk about some of these cysts individually?
Of course. So a cyst is basically a collection of water. Okay, most of the cysts are non-cancerous. The only one that you have a little bit concerned is when you talk about an ovarian cyst. In an ovarian cyst, it's very important for us to look and see what is the wall of the cyst like. If it's a thick wall cyst and a thin wall cyst, it's very different. A thin wall cyst means that the wall of this particular cyst is very thin, and then these are generally benign. But if it's a thick wall cyst, then you have to be a little bit more concerned, because sometimes in the wall of the cyst, it can be malignant. So again, by and large, most of the cysts that you're talking about, the cysts in the thyroid, the breast, the kidney, the liver, no concern. Ovarian cysts, you have to pay a little bit more attention to the nature of the cyst.
Ovarian cyst is very common, right?
Ovarian cyst is very common, and that's why it's important for us to differentiate the different types of ovarian cysts.
Okay. Can you expound more on what they will do? Because a lot of people have ovarian cysts, whether it should be operated, what is the algorithm to find that? So
again, generally all cysts, nothing to worry about. But if it's an ovarian cyst, often we say that it needs to be followed up. If it's a thin wall cyst, not really important to do anything. But it's a thick wall cyst, then you may need further evaluation. The simplest in actual fact is just to monitor it. You can monitor it in a 3-monthly interval, 6-monthly interval to see whether the cyst grows. By and large, cysts should not grow. Cysts should not grow. But if you have a thick wall cyst that's growing, then certainly you need to talk about doing blood tests to see whether there are any cancer markers that are raised. And then, of course, in the worst case scenario, you would talk about removing the cyst to confirm whether this is malignant or not malignant.
So when do you remove the cyst?
Okay. As a general rule, we try not to remove cysts because, breast cysts and so on, some patients can have 30 breast cysts. If you go and remove cysts, you're just trying to make money from the patient. So by and large, cysts should just be